And from the south-south, we go over to the southeast, and this is on the state's response. In Enugu State, we understand the cases overview show 18 people have died since the virus outbreak, while 425 have recovered from the total confirmed cases, which today stands at 801. We have Dr. IKECHUKWU, an associate professor of public health medicine, also the commissioner of health in Enugu State. He joins us on the program via Skype. Thank you for joining us at this time. How much is Enugu State testing?
Okay, Millicent, I think when you say how much is Enugu State testing, we're testing as much as we can, because recently, testing in Enugu State was that we were collecting samples and then we were taking the samples to other reference laboratories. Recently, we started testing with the gene expert testing that is now available at UNTH. And only recently, also a few days ago, the NCDC also activated the MCR-PCR laboratory in Enugu at the UNTH also. So for now, about the total number of samples that have been taken for Enugu, about 3,608 samples that have been taken. I will tell you that it's not all of them that the results have come back, but since we have started testing with the gene expert and also with the MCR-PCR in our Federal Teaching Hospital, UNTH, we are ramping up our testing, and then I'm sure that very soon we will be all out to be doing testing as much as we can.
How much is community testing do you plan to go into communities to also test as many people as possible, seeing as testing is one of the major priorities for locating the virus? How much of that is in the works?
In the works right now, as is clear in our incident action plan, is that we are setting up to have sample collection sites in all our local government areas. That is what we have in our incident action plan, and we are working very hard towards making that happen, making that possible. So once that is in place, we'll be able to collect samples in all our LGAs, and these samples can now be transported to our central testing in the Federal Teaching Hospital. So community testing is getting very close to happening in Enugu State.
All right, we're also told that most people who fall sick with COVID-19 will experience mild to moderate symptoms, and some may even recover without special treatment. What's the nature of those currently on admission in the state?
Oh, for Enugu, we have admitted everyone. We have admitted those who are mild to moderate cases, and we have also admitted severe cases. We have 4 isolation and treatment centers, and 2 of the isolation and treatment centers are located in teaching hospitals in the state, one in the Federal Teaching Hospital, UNTH, and the other one in the State Teaching Hospital called Enugu State University Teaching Hospital, Park Lane. So a lot of our severe cases are actually treated at the isolation and treatment centers in the teaching hospitals. But mild and moderate cases we also admit, and we admit them in our isolation and treatment center at Nsukka, and also at our isolation and treatment center at the diagnostic center in Enugu State. So okay, we are admitting mild to moderate and also severe cases. And incidentally, we have also started to provide some home-based care also for patients who we find suitable for this type of care, especially those who have the facilities to be able to completely isolate themselves. Then we are doing some home-based treatment for them also in Enugu.
All right, we continue to wish yourself and the state government the best as we contain the virus. Thank you for joining us, Dr. IKECHUKWU, Associate Professor, Public Health Medicine, Commissioner of Health in Enugu State. Thank you for joining us.
Thank you for having me.